Okay, hello and welcome to today's webinar, Skin Aging and Aesthetic Medicine, Become a Trusted Expert. Before we get going, can I please just ask that you all turn your cameras off and also just place your microphones on mute as well. I can see we've got a few people still joining, so what I'll do is just give you all a couple of minutes to get settled in. And as I said, if you can just turn off cameras and microphones, that'd be brilliant. Okay, great. So yeah, hello and welcome to today's webinar. So hi to our current viewers, but also hello to those of us who are watching us back today. Throughout 2021, we're going to run a series of webinars focusing on skin aging and aesthetic medicine here at the University of Manchester. So today's webinar is the first of the series, and we really just want to provide you with a clear overview of the course, but we also want to look at the current aesthetic arena and why now more than ever we need regulation to ensure those administering treatments are medically trained within the industry. As you can see from the agenda, we should be looking at a webinar of around 30 to 40 minutes today. Please do remember we've got the Q&A session at the end as well, so please use the chat function and send me any questions which you would like me to put to the expert panel. I'll run through a brief introduction. I'll then hand over to our course directors and they'll take you through the current aesthetic arena, and we'll also cover the course structure, content and delivery. Okay, so first of all, why Manchester? So as you can see, we're a leading research intensive university with 83% of our research is ranked as world leading or internationally excellent. We've had 25 Nobel Prize winners who've either worked or studied with us. Credibility wise, we are ranked the 5th best university in the UK and 27th best in the world. We're part of the prestigious Russell Group, and also our reputation is backed by a rich heritage of achievement stretching back to 1824, so we have been around for quite some time. Anyway, I know you're all here today to really speak with our course directors, so what I'll do, I'll hand over to our clinical director, Tamara Griffiths.
Hello, everyone, and welcome. I'm Tamara Griffiths. I'm a consultant dermatologist and the medical director for this program. And I'd like to welcome you and delighted you're interested in this program, delving into an arena that is dynamic and rapidly changing, and an area where really there is no formal standardized training program. So a lot of the education clinicians or practitioners get is a bit ad hoc, a bit random, and there's no set regulated program. So this is a gap that we're looking to fill with this program, designed to deliver you the highest quality education in this area with no gaps, so you really feel secure and have the confidence to deliver high quality practice. The industry is huge, as you know. Every high street has non-surgical procedures on offer, estimated to be approximately 3.6 billion pounds a year. And despite the industry growth, the regulation and the checks and balances have not followed. Training and clinical practice is fragmented, delivered by a broad group of practitioners, and really there is treatment being delivered potentially with very dangerous medical or surgical complications by people who have very little understanding of the skin or adverse events that can occur. So in this program, we're really trying to cover the main modalities of non-surgical practice, and this includes botulinum toxin injections, chemical peels, dermal fillers, laser, and other light-based treatments such as IPL. That really covers the whole armamentarium of the commonly used treatments available. We are trying to improve regulation and standards through voluntary registers, liaison with government groups such as the Department of Health and Social Care, as well as the GMC. Our goal is to really raise the bar ultimately for patient or client safety, and we feel education is a very effective tool in doing this. The program is very much evidence-based, so you get to learn how to discern fact from fiction and myth, which I think is rife in this area. And we hope it gives you a wonderful background in all aspects of aesthetic medicine. I'd also like to introduce you to the other directors. Dr. Helen Graham is the academic course director. She's highly qualified with a PhD in biochemistry and extracellular matrix and has worked intensively with this course for a number of years. And also Professor Rachael Watson, who was a real leading light in cutaneous science, particularly in skin aging worldwide. And we're really very lucky to have both of these individuals working on the team.
So thanks, Tamara. That's a really kind introduction. Welcome, everybody. My name's Rachael Watson. As Tamara said, I'm Professor of Cutaneous Science here at the University of Manchester, and I've been here for some number of years now, since 1994. So one of my roles in Manchester is really to tell you a little bit about dermatology research. So the Academic Centre for Dermatology was established in 1994. We are internationally renowned for our research, and that research is very broad. It covers inflammatory skin diseases, it covers psychology of skin disease, right the way through to the basic sciences. And within the basic sciences, we have in particular expertise in understanding extracellular matrix remodeling, particularly in relation to skin. So as a department, we are the leading department in the UK. So if you look at our publication power, our research power, we are #1 nationally. And this is in part due to the really very close working relationship the scientists at the University of Manchester have with our clinical academic colleagues who provide services which come out of Salford Royal NHS Trust. And really, it's the combination of the research science-based and the clinical needs setting that have made dermatology in Manchester such a strong centre, both for research and for study. So to tell you a little bit more specifically about our programme, so here are our entry requirements. You'll see that it's important that you have a clinical degree. This might be a medical degree or an overseas equivalent, a dental degree or overseas equivalent. And this year, for the first time, we've opened our course up to nurse prescribers. So those of you who have completed successfully the independent nurse prescribing course and are registered as a practitioner with the NMC. So at this point, I'm going to hand over to Dr. Graham, who is course director for the academic delivery of the programme, and Helen will tell you much more detail about how this course is structured and how we deliver this unique and important training.
Thank you very much. So thanks for joining us today, and I'm going to give you an overview of the course structure. So we can take this, deliver this programme as 4 separate CPD units, and those can be taken individually, or you can take them as a collective, and by passing all 4 units, you can be awarded the postgraduate certificate in skin ageing and aesthetic medicine. So each one of the units lasts for a fixed period of 10 weeks, and there's no on-campus exams. All the assessment is by coursework and online multiple choice questions or discussion groups and group work. So there's no end of year final exam. You can take up to 4 courses, 4 units in each year, and the key thing to remember is that the first unit is fundamentals of skin aging, which provides the real basic knowledge and basic understanding of skin structure and function and how it ages. And this is a prerequisite unit for all the other units. So once that unit's been taken, you can then pick and choose between the other units that you'd like to take. So there's a maximum of 24 months to complete. So you can either take each unit back to back, or you can take a unit and then have 10 weeks off and then take another unit. As long as you complete that in 24 months, you can be awarded the postgraduate certificate. So We have 4 units. The first unit, as I've said, is the prerequisite unit, and it's 15 credits. So if you take this as a CPD, you'll be awarded a 15 credit unit. This starts in December 21. And fundamental staging, as I've said, really provides that baseline knowledge that you need to then use as your foundation to understand the mechanism for the therapeutics that you'll be using later on. So we look at the components of the skin, the structure of the skin, extracellular matrix components, and the effect of photodamage and aging on those components. We also have skin rejuvenation, which is unit 2. So this looks at the more topical treatments and the non-invasive treatment. Starts in November 21, and unit 3 is in injectables, which focuses mostly on botulinum toxins and dermal fillers. And again, this is a 15 credit unit, which commences in February 22. And the final unit is lasers and light therapies. So looking at the different modalities of treatment, understanding the basics of laser and light, and the safety aspects around that. So that commences in 2022. So as I've said, each unit is delivered over a period of 10 weeks. And the recommended study time really to enable you to review all the video lectures and to be able to engage with the discussion groups and journal clubs, you really need to allow around 15 hours per week across those 10 weeks. So that equates to 150 hours per unit of study time in total. So you'll have access in those each of those units to the full online program. So all of the resources are online. We have recorded video lectures, we have recommended reading, and we run journal clubs, we have tutorials. Okay, so I've just touched on this in the previous slide, but when you are working through the unit, we like you to really interact so that you're able to engage with your peers. Your peers will be from a range of backgrounds. We have GPs and dentists, nurses, ophthalmologists, and it's really key to be able to get their perspective. So we have a number of different interactive activities for you to take part in, and as you work through the program, you'll see these boxes which really encourage you to delve deeper and consolidate your new learning from those video lectures. So after a video lecture, you might be asked to think about an activity or a key ethical consideration regarding that piece of new information. We encourage you to go into the reading that's been recommended in the lectures. We have discussion forums where you can, as a group, small group discussions where you can use a discussion thread to discuss an issue around that lecture that you've just watched. We have a journal where we ask you to write your own personal notes, and this is for your own records, really. We have tests and online quizzes and case studies which allow you to monitor your progress through the program, and you can also go back and revisit those quizzes if you feel like you haven't done as well as you could have done. Okay. So at the end, you'll see in yellow boxes, you'll always see a summative assessment, and this is the assessment that will provide your unit mark, and so therefore you know that you should be working towards that assessment at the end. Okay, so I've just briefly touched on that, but as I've said, the assessments, there's no final exam, and there are different assessment types in this PG Cert program to really sort of enable you to explore different learning types. So we have some video elevator pitch presentations where we ask you to present to camera and record your presentation to be assessed. We have some peer review reports where we review each other's each other's work and write a report on that. We also use discussion forums, and that discussion thread enables students to really talk to each other and explore other areas that they might not have considered. We have video mock consultations, and we ask you to submit those videos for assessment. Critical appraisal is a key element of this programme, so we really encourage you and provide tools for you to be able to look at studies and to be able to ascertain whether you believe yourself that there's sufficient evidence base for you to employ those new therapies in your own practice. Video presentations, as I've said, and there are also multiple choice questions and short answer questions. So although this is a fully online programme, we really embed activities to enable you to interact with your peers and tutors, and it's a real key part of the programme. And by the end of these programmes, the students that have graduated have formed a network where they can interact. And this goes beyond graduation, so it helps you to form your own network for discussions after you graduate. So those discussion activities really help to enable you to interact with your peers and benefit from their perspectives. We also have academic advisor support, and we run live video tutorials. So this is really the only synchronous element that you need to make sure you embed in your diaries. And we run 2 to 3 live video tutorials per unit. And we invite a guest speaker who's an expert in the field, and it's a great opportunity for you to ask your own questions of those clinical tutors. And we run online journal clubs where if you find a paper of interest or that's really quite controversial, we encourage you to share that with others so that we can discuss the pros and cons of those journals. Okay.
Wonderful, thank you, Helen. As well, just looking at some of the feedback we've had from our past cohort, the course really is designed to provide you with the skill set to practice safe, evidence-based aesthetic medicine. And as Tamara said, with the growth of the aesthetic industry, it's so important that we have trained professionals delivering such potentially harmful procedures. And we do understand as well that learning online and dedicating the time to studying something new can seem daunting. So as I said, we've got lots of testimonials from previous students, and hopefully as well throughout 2021, as part of our webinar series for skin aging and aesthetic medicine, we're also hoping to have some student insight sessions as well, which I think would be really beneficial, so you can then interact with some of our previous cohort and ask them obviously how they found the course, and obviously what happens after completing as well their studies. If you are interested in the up and coming webinars, then you can just email me at studyonline@manchester.ac.uk, and I can obviously send over some of the webinar dates. You can pop those in your diaries. Okay, so now we want to hear from you guys. I know some of you have already emailed in some questions before the webinar, which I'll put to the panel, but also I can see we've got some questions as well that have come through on the chat function. Okay, so let's start. We had an email from one of the prospective students saying, why is the fundamentals of skin aging a prerequisite unit? Would anybody like to answer that one?
Perhaps I'll take that, so as this is my arena.
Yeah.
So I think what's really important is that when we look to efface the signs of aging, that we really understand what's going on in the tissue. So we need to understand that when we age, it's not just about the superficial skin, it's also about changes to the musculature, to the bones, to the fat pads, etc. So we're not just treating skin by using aesthetic treatments, where you were looking at the patient holistically. And to do that, you have to have a real good understanding of the changes that happen, not only to the skin, but to the deeper tissues as well. So that's why we feel that without that fundamental basic science knowledge, you're really not well prepared to look at the treatment modalities that you might have.
Wonderful, thank you, Rachel. We've had another question as well, which I believe we have actually come across before, and that's, why is there no practical element to the course?
So this is very much a knowledge-based course. What we as Tamara spoke about, and I'm sure she'll comment on this as well, training tends to be one-to-one with practitioners in the area, and that is difficult to deliver in an educational environment. What we want to do is make sure that as you move into practice, that you have all the information that you need to really hone your skills in the clinical arena. This is very much an educational course.
I think the other thing I'd like to add is we do have more postgraduate opportunities for hands-on experience with the diploma and the master's. So for people who are really keen, there are more developed postgraduate educational opportunities that do involve hands-on training.
I think it's important though to say that by doing those higher courses, there isn't an accreditation. It's not accredited as or a fitness to practice. It's really just exposure so that you can observe other professional colleagues demonstrating those techniques to you.
We've actually had a question come through which might be linked, may have already been covered, but Alison's asked, how does the course tie in with your master's degree?
So they run alongside Alison. So essentially what we have, the PG Diploma and the Master's course are additional programmes that you may choose to study. For the PG Diploma, what we ask you to do is to also have, there are additional units. So we go from 60 credits up to, and Helen will correct me if I'm wrong, 120 credits that allows you to exit with a PG Diploma. Those extra units are in the areas of research and governance and in the areas of invasive surgery, so understanding the difference between where your skill set ends and where you might want to refer on to a plastic surgeon, for example. And there's also an element of professional portfolio that comes as part of that PG diploma. For the Masters, we ask our students to take a 1-year project on board, and they tend to be research projects, and at that point you're aligned one-to-one with a research supervisor. So very much a research degree as opposed to a knowledge-based only degree.
Alison, I hope that answers your question. Please do, as I put something else on the chat, if you've got any additional information you'd like to know. We've had a question from a lady called Lucy. She said, my working hours often change. What happens if I miss tutorials, and how long will it take me to complete the course?
Thanks, Lucy. I'll take this one if that's okay. So the tutorials are recorded, so whilst it's best and you probably get most benefit from being able to ask questions live, we do record them, and so we understand that people are in different time zones and have clinical commitments, so we always make sure that those sessions are available as a recording for you to watch at a later date. What's the other part of the question, sorry? What happens working?
How much time would you need to set aside?
How much? Oh yeah. So how much time is usually we advise that 15 hours per week for study should enable you to both work through the course content, but also enable you to read sufficiently to prepare for the assessments at the end.
Wonderful, thank you, Helen. Julian has asked, are we able to complete the PG cert and then at a later date do the additional units for the diploma through research projects?
Shall I take that, Rachael? So currently, the answer to that is currently no. You apply for either the PG cert or the PG Dip Masters. The reason is the units are slightly different between each one. Potentially in the future, we can you might be able to move on to that pathway, but currently as it stands, you either apply for the PG cert or the Masters.
So, but however, I think it's important to mention that there are other units that could be added to the 4 core units here, which will provide you with a PG diploma, but it wouldn't be specifically in skin aging. It might be broader. So you might choose to take a unit on bioethics, or if there are dentists in the audience, you might choose to take a module on restorative dentistry, for example. So there are other ways. It's called a stackable model. At the moment, there's only enough content for the PG cert specifically for skin aging and aesthetic medicine, but there's opportunities to augment that learning with different areas to build to a PG diploma.
Wonderful. Thank you, Rachel, Helen. We have another question. This is from Elizabeth. She says, if you are an aesthetic nurse without the V300, are you excluded from applying for this course?
So Tammy, I don't know if you want to comment on that. I think it's important, and often it depends whether you're working very closely with other practitioners. Certainly if you are working independently, we would expect that prescribing qualification, because as you know, it's illegal to let somebody else prescribe on your behalf and then do the application yourself if that initial person hasn't seen the patient or the client that you're working with.
Yeah, so at the moment, the entry criteria is to have the nurse prescribing accreditation at this point in time.
Wonderful, thank you. I think that's all for our questions for now. As I said, I just want to thank everybody again for joining us today, but also a special thank you to Tamara, Helen and Rachel for joining us. If you are watching back, we are still taking questions, so please do send any questions you'd like the panel to answer through to myself. Again, it's studyonline@manchester.ac.uk. I just want to let you all know as well that we are now accepting applications for the PG cert in skin aging and aesthetic medicine, and we have received a number of applications already. So if you are interested, I'd like to encourage you to apply sooner rather than later to secure your place. Thank you again for watching. As I said, this webinar has been recorded, so it'll be available to watch back. So if there's anything you're unsure of or you've missed anything, it'll be on our YouTube talent channel, which again I can send through to people on a link. So as I said, any questions, still email them through, but I said thank you so much to our panel today.
You're very welcome.
And we hope you've all enjoyed the webinar. Thank you so much for watching.
Thank you.
Thank you.
Bye.